Okay, so yesterday we were talking about mechanisms that maintains the acid base balance. Okay, so there are three mechanisms in which the acid base are balanced. First one is buffer system or buffer mechanism, respiratory mechanism, as well as renal mechanism. So we look into detail what are these mechanisms. Okay, see, these are normal mechanisms which compensates the acid base balances. So first one is the buffer mechanism. So in a simple note, how we can say the buffer mechanism is that it is a rapid first line of defense. Okay, that it takes only seconds to come into action. Okay, it combines relatively with the strong acids or the bases to convert them into weaker acids or the bases to prevent marked changes in the blood pH. So, okay, that is the first and the foremost point of the buffer mechanism. See, what happens in this buffer mechanism is that combine with strong acids or the strong bases. Either it can be an alkali or it can be a base. Okay, that's the first action of the buffer mechanism. For example, if your blood is having or any change, any abnormal change in the pH level, first first line of defense will be the buffer mechanism. So what the buffer mechanism initially does is that it will combine with the relatively strong acids as well as bases to convert them into weaker acids or base. Thus there is a marked change in the blood pH level. Okay, so that which means they prevent the change, they will prevent the marked change in the blood pH level. Okay, these are often referred to as buffer pairs because it consists of weak acid and a basic salt. Okay, the buffer mechanisms will it consists of your basic salt as well as a weak acid. And third one is a bicarbonate buffer system. That's also comes under this buffer mechanism. Bicarbonate buffer system. So in the bicarbonate buffer system, the most important buffer in the body fluid. Okay, bicarbonate buffer system is the most important buffer in the body fluid because its components are the base bicarbonate, that is HCO3, and the carbonic acid, that is H2CO3. Okay, so the basic components are the bicarbonate as well as the carbonic acid and are actively and constantly regulated by actions of the respiratory as well as the urinary system. So the second point which you have to focus is nothing but it consists of a base bicarbonate and a carbonic acid, which is controlled by the respiratory as well as the urinary system. And the third one is that when the body is in the state of acid-base balance, when the body is in the state of acid-base balance, it contains 27, it's around 27 milli-equivalent base of bicarbonate per liter and 1.3 milli-equivalent carbonic acid per liter. Okay, so when your body is in the state of acid-base balance, the bicarbonate level is around 27 milli equivalent per liter and the carbonic acid is 1.3 milli equivalent per liter. Okay, that is a bicarbonate, which is known as the bicarbonate carbonic acid ratio, that is 20:1. Okay, so in the buffer system we were talking about, it combines with the strong acids as well as the base, and it converts or it will prevent the marked changes in the pH level of the blood, and it also consists of weak acids as well as the basic salt. And the basic components is bicarbonate as well as the carbonic acid, and we had seen the ratio of that. So that was about the bicarbonate buffer system. Second one is the phosphate buffer system. Okay, so since the buffer system, how the buffer system act is that it will combine with the strong acids as well as the base. So that is the underlying principle behind the buffer mechanism. So how many buffer systems are there in the body? So first one was a bicarbonate buffer mechanism, which consisted about the bicarbonates as well as the carbonic acid. The second buffer system is the phosphate buffer system. So this is the more important intracellular fluids, okay, where its concentration is considerably higher. Okay, we have said that inside the cells we'll be having phosphate. So it is mainly acting inside the intracellular cells. Shiny, could you please mute your mic? Okay, third one is the protein buffer system. Okay, so first one was bicarbonate buffer system. Second one is phosphate buffer system, which is acting inside the intracellular fluid. And third one is the protein buffer system. Okay, so what is a protein buffer system? What are the proteins inside the blood? First one is the hemoglobin. Okay, a protein buffer promotes the movement of chlorine across the RBC membranes. Okay, and it helps in the exchange for the bicarbonate ion. So simply protein buffer system focusing on the hemoglobin. So that was about buffer mechanisms. This is the first line of management or first line of defense comes when the bodies or one of blood's pH is altered. Clear? So when the pH of the body, pH of the blood is altered, first line defense mechanism which comes into action is the buffer system that takes within seconds. So buffer system, we have mainly three types of buffer systems: bicarbonate buffer system, phosphate buffer system, and protein buffer system. Bicarbonate buffer system comprises, or the main components of bicarbonate buffer systems was bicarbonate as well as the carbonic acid. Whereas a phosphate buffer system, it mainly acts in the inside the cells. And the third one is the protein buffer system, which mainly comprises of the hemoglobin. Next is the respiratory mechanism. How the respiratory mechanism maintain the pH of the pH of the blood. Okay, so the respiratory mechanism, it is a second line of defense mechanism. It takes some minutes to come into action. So in the first how the respiratory mechanism acts is that the carbon dioxide is carried in the blood in the form of carbonic acid. So we know that the carbon dioxide is carried in the blood as in the form of carbonic acid as well as the bicarbonate, and the control of the carbon dioxide exhalation from the lungs. So how it is, it controls the rate of the carbon dioxide which is exhaled from the lungs. Okay, in the respiratory mechanism, it controls the carbon dioxide exhaled from the lungs. See how when it controls, when there is an increased amount of carbon dioxide in the body, the medulla is stimulated to increase the rate and depth of the respiration. That is the first point. And the second is when there is a decrease in the amount of carbon dioxide in the body, the rate and depth of the respiration decreases. Okay, so that is the mechanism by which the carbon dioxide is controlled. It controls the rate of carbon dioxide which is exhaled from the lungs. Okay, and what next? So during this body mechanism, during the body's metabolism, carbon dioxide is produced, as you know, which reacts with the water to form carbonic acids, which resulting in the decrease in the pH. Thus, the pH is decreased. Okay, and in the lungs, when the carbonic acid breaks down into carbon dioxide as well as water, it increases the exhalation of carbon dioxide, which results in the pH increase in the pH. Okay, so that is the mechanism by which respiratory system act as a second line defense mechanism. So when the primarily due to any reasons, like might be due to kidney failure or due to any increased respiratory arrest or any conditions which alters the pH. So when the body's pH is altered, the first line of defense mechanism that comes into action is the buffer mechanism. So when the buffer mechanism will be activated within seconds. When your buffer mechanism fails, so you know that we have mainly bicarbonate buffer system, phosphate buffer system, as well as protein buffer system. So when these three buffer mechanisms fails, next line of defense mechanism comes into action, that is the respiratory mechanism. So how the respiratory mechanism acts? The respiratory mechanism acts by controlling the rate of carbon dioxide that is exhaled from the lungs. So how it is mainly maintaining the pH of the blood? pH of the blood is that during the metabolism, the carbon dioxide is produced, which reacts with the water to form the carbonic acid, resulting in the decrease in the pH. And also in the lungs, the carbonic acid breaks into carbon dioxide as well as water, which increases the exhalation of carbon dioxide, which results in the increase in the pH. So that was how it controls the carbon dioxide during the exhalation of the lungs. Next is the renal mechanism, which also comes under which is a third mechanism. So the renal mechanism, that is the third line of mechanism. It takes some hours to days to come into action. Okay. So here the kidney functions to the kidney function to increase the blood sodium bicarbonate content and decreases the carbonic acid content. Thereby, it increases the base bicarbonate as well as the carbonic acid ratio and the blood pH. Okay, so the kidney increases the blood sodium bicarbonate level and it maintains the ratio of the blood pH level. Okay, when there is a high levels of hydrogen ions in the blood, what happens? if your body is having high levels of hydrogen ion, what does the kidney does? So it secretes hydrogen ions and reabsorbs sodium ion. Okay, the kidney secretes hydrogen ion and it reabsorbs the sodium ion. And second one, the form ammonia. The kidney will emphasize the formation of ammonia that combines with the hydrogen atom to form ammonium ions, NH4 plus. Okay, so the ammonia combines it form ammonia to combine with the excessive amount of hydrogen ion to form the ammonium ions, which is excreted from the body. Thus, the sodium ion is reabsorbed into the blood. Okay, and one more thing is there. It was when there is a low level of hydrogen ions in the blood, so that the kidney retains the hydrogen ions before forming it into the bicarbonate ion. Okay, so that are the three buffer mechanisms that activates or manages the acid-base balance. So when you are very thorough with the basic acid-base mechanisms, you will be very clearly have to identify what are the imbalances which is happening in the body. So in the next second slide, we are going to see what are the imbalances in the body. See, these are the acid-base imbalance. You clearly know that we have only 4 disease conditions which emphasizing on the chromatic examination. So those are respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. So you can see the word acidosis itself indicates the pH is decreased. So in all the conditions, see if there is an acidosis, the pH is decreased. Guys, please take the screenshot of this. This is important. There is a 70 to 80% chance that you may get questions from this slide itself. Okay, so when there is an acidosis, the pH will be decreased, whereas when there is alkalosis, that is, the pH will be increased. And you can see the condition about the partial pressure of oxygen. So you know the respiratory. When the respiratory, the name itself indicates the respiratory, the partial pressure of carbon dioxide will be more than 45 mm. Okay, so in respiratory, the partial pressure of carbon dioxide will be increased. Clear. So in case of respiratory alkalosis, the partial pressure of carbon dioxide will be decreased. So in metabolic, both in metabolic condition, partial pressure of carbon dioxide stands normal. So this is the first line. Okay, this I am talking about the acid-base imbalances which happens in the first line. Okay, that is known as the primary disturbance. This is the findings of the primary disturbance. There are two types of disturbances. First one is the primary disturbance, and the second one is the compensatory disturbance or a compensatory mechanism of the body. In the compensatory mechanism, in the metabolic acidosis, the partial pressure of carbon dioxide will be decreased, and the partial pressure of carbon dioxide will be increased in case of metabolic alkalosis. Okay, that's a compensatory mechanism, and I don't think you will be getting questions from compensatory mechanism. Mainly, in most majority cases, the questions are mainly asked in the acid-base imbalances. Okay, the other one, the compensatory portion, is in the pure clinical area, which we'll be focusing those conditions in case of ventilated patient or the patients is on patients who are on BiPAP ventilators, that is non-invasive ventilators. So most probably a question will be coming from this plot itself. Okay, so the respiratory acidosis, there is a decrease in the pH, increase in the carbon dioxide, and bicarbonate ion. The bicarbonate ion will be normal in case of respiratory conditions, whereas metabolic, so when it is acidosis, the bicarbonate ion will be decreased and the bicarbonate ion will be increased in case of metabolic alkalosis. And when you focus on the causes, so what are the causes of respiratory acidosis? So it should be respiratory acidosis when the respiratory system is affected. So the causes mainly dyspnea, any tumors inside the lungs, asthma, emphysema, pleural effusion. All these conditions will causes respiratory problems. Okay, and see the difference between the respiratory acidosis and respiratory alkalosis. See, in respiratory acidosis as well as the respiratory alkalosis, both can be caused by dyspnea. Okay, but the underlying causes may be different. So, in case of respiratory acidosis, there must be something related with the rest, or there must be a connection between something metabolic and respiratory. Okay, so you know that in case of asthma, in case of tumors, there is some metabolic problems which disturbs the bicarbonate level, okay, which leads to disturbance in the pH level, and it leads to fall of pH. That is, excessive hydrogen ions are released in these conditions. So the dyspnea, the tumors as well as asthma and emphysema are predominant causes of respiratory acidosis. Whereas in alkalosis, for your exam point of view, just think about excessive mechanical ventilator. So when the patient is on excessive mechanical ventilator, they will be having respiratory alkalosis. So the condition same implies in metabolic acidosis also. Okay, so starvation. So ketoacidosis, diabetic ketoacidosis, then diarrhea, cancers in case of lactic acid accumulation. Okay, so those are the exam point of areas where the metabolic acidosis takes place. Okay, starvation, diabetic ketoacidosis, cancer, diarrhea, lactic acid accumulation. And in case of metabolic alkalosis, vomiting and decompression. Okay, that is the gastric decompression. And alkaline drugs, when given alkaline drugs, which leads to metabolic alkalosis. So the next condition. So this is the area which you have to focus on. So the main deficiencies, the questions will be arising from hypokalemia, hyperkalemia, hyponatremia, hypernatremia, and hypocalcemia, and hypercalcemia. Okay. Okay, so before moving into that, we can check what is the deficiency, what are the causes of the deficiencies of extracellular fluid. So you know that extracellular fluid is the space which may be between the cells or the blood inside the blood vessel, or fluid inside the blood vessel, or the fluid inside any small areas like synovial fluid, etc. Okay, so we see we can. The main area of focus is this extracellular fluid is interstitial fluid as well as the fluid inside the blood vessel, the fluid in the blood column or the blood vessels, that is mainly the plasma. So what are the etiological factors that causes ECF deficiencies? So you know that fluid intake deficiency, when you are taking a lesser amount of fluid, that is dehydration, or if you are having fever, which means your body fluid is lost through evaporation. Then then condition is vomiting, diarrhea also. Then diuretics, usage of diuretics, hemorrhages, diabetes insipidus. So all these conditions will cause fluid volume deficiency. See, ECF deficiency is fluid volume deficiency. Okay, this fluid volume deficiency is mainly focusing on the blood circulation. Your blood volume is decreased in case of ECF deficiency. So those are the causes of. So what happened? Okay. Then next is the signs and symptoms. So what happened in case of signs and symptoms? What are the signs and symptoms that showcases in case of fluid volume deficiency? You know, there will be a thirst, increased thirst. Thirst will be the skin will be dry, temperature, increased temperature, pulse will be rapid. There will be a weak and thready pulse will be the cardiac output will be there. That is, pulse will be rapid. Okay, feeble pulse yet rapid pulse, and cardiac output will be increased it for the prime compensatory stage. For the next stage, there will be decrease in the cardiac output. Okay, that is to compensate the deficiency. There will be increased cardiac output. If the heart is pumping more and more blood, even if even though there is no blood circle, adequate amount of blood inside the blood vessel, the compensatory mechanism also fails. So treatment, what is the treatment of fluid volume deficiency? What is the treatment for high dehydration? Simply you have to give isotonic solutions like normal saline is more than enough. So the vasopressin. So vasopressin is given for diabetic insipidus. Okay, and blood transfusion if in case of hemorrhage. Okay, other conditions like deficiency in the fluid volume or in the vomiting deficiency, we'll just give the isotonic solutions, normal saline. So if it is diuretic induced deficiency, that is for example Lasix induced deficiency, we'll just taper the Lasix down. Next is the fluid volume excess, that is overload. What are the conditions that causes overload in the fluid volume? That is overload in the heart blood circulation, that is heart failure. heart won't be able to pump normal amount of fluid into the body. Liver diseases, malnutrition, renal diseases, excessive parenteral supply. For example, if you know if a person is bedridden, so we are continuously giving the person IV fluids like 7 or 8 pints of NS or RL to that patient. That will lead to an excessive parenteral fluid, and it causes uh, um, excessive fluid overload. So signs and symptoms, there is a weight gain. Obviously, there is a weight gain. Why crackles? Crackles can be seen because the fluid might be deposited in the pulmonary kind of areas where it leads to pulmonary edema. So that's why crackles are seen. So edema might be a generalized edema or area specified edema. For example, pitting edema can be seen in the lungs or anasarca, generalized body edema. Next, ascites. In case of liver diseases, then BP as well as pulse, there will be increase in the BP as well as pulse will be increased. Rapid change in the pulse as well as the BP can be seen. So treatment, what is the treatment? Just give diuretics. If it is, if the diuretics can be given in case of heart failure as well as what your excessive renal conditions. So dialysis is the treatment of choice if it is renal failure. Okay. So next condition is hypokalemia. So what are the causes of the hypokalemia? So you know that hypokalemia, potassium is the main thing which is seen inside the blood cell, that is ICF inside your cell. So when there is a deficiency of potassium in the extracellular fluid, we'll say it as hypokalemia as well as hyperkalemia. Okay. So in hypokalemia, you know, the diarrhea, vomiting, are the main conditions, and the next condition is diuretics. So excessive amount of giving diuretics, then excessive production of aldosterone, then diabetic ketoacidosis. So you know that both hypokalemia as well as hyperkalemia, both the conditions will lead to arrhythmias. So in case of hypokalemia, it will cause what? Abdominal distension, whereas hyperkalemia won't cause any abdominal distension. But nausea, vomiting is classical in case of hypokalemia as well as hyperkalemia. So if you are identifying the patient is having hypokalemia, we'll treat with potassium chloride. Normally, for a 10 ampule, we'll be having 20 milli equivalent of potassium and 20 milli equivalent of chlorine. So, for example, the if a patient is having 2.2 milli equivalent of potassium, we'll go for 40 milli equivalent, that is 2 ampules of KCl over 8 hours. So that is the treatment of choice for hypokalemia. And in the hyperkalemia, so burns, main thing, there is a rupture of areas, kidney failures, decreased aldosterone, and potassium sparing diuretics. So give me an example for potassium sparing diuretics. Spironolactones, and loop diuretics, our Lasix. So in case of hyperkalemia, we can see arrhythmias as a signs and symptoms. So the treatment is nothing but first we can go for diuretics. If the causes of potassium sparing diuretics, we can avoid that potassium sparing diuretic and go for what loop diuretics, which will flush the entire potassium outside the body. And hyperkalemia, the management of hypokalemia, glucose as well as it will go with glucose drip, that is DNS drip, in which we'll add the insulin then. So that is the first line of drug of choice. And the condition dialysis also in case of kidney failure. If the patient is having kidney failure and which causes hyperkalemia and arrhythmia, we'll directly go for dialysis. And hyponatremia, you know, the usage of diuretics like Lasix. So suctioning, abdominal, this gastric lavaging, nausea, vomiting, diarrhea, all these conditions leads to hyponatremia. So cramps, oliguria, and seizures are the basic signs and symptoms of hyponatremia. Okay, and the hyponatremia is again divided into symptomatic hyponatremia as well as asymptomatic hyponatremia. Okay, so symptomatic hyponatremia is the condition whereby the serum sodium level will be less than 120 milliequivalent per liter. Okay, so millimoles per liter. So when your serum sodium level is less than 120, the patient will be showing symptomatic hyponatremia, which means in that condition the patient will be disoriented, his seizures or cramps will be precipitated. But in case of when the sodium level is more than 120 and it is less than 135, that area of that the value area is known as asymptomatic hyponatremia. That is, the patient won't be showing any signs and symptoms, but the patient is on hyponatremic stage. So the treatment is, if the patient is in asymptomatic hyponatremia, we'll encourage the patient to increase the salt intake. Or if the patient is in symptomatic hyponatremia, we'll go for 9.9% NS or 3% NS for 8 hours. Okay, that is the management of hyponatremia. Next is a hypernatremia. That is diabetes insipidus and water deprivation is the cause of hypernatremia. So skin and dryness will be the tongue will be dry. So hypernatremia, water deprivation as diabetes insipidus is the main reason. So treatment is given for that etiology. Okay, no, we don't correct the hypernatremia as such, but we'll correct the etiological conditions of hypernatremia. Next is hypocalcemia. So accident removal of parathyroid gland. So we know that a patient after thyroidectomy, after 6 to 8 hours, we have to check whether the patient is having tetany, or we'll go for serum calcium level to identify any signs of hypocalcemia. Okay. Then pancreatitis and alkalosis. So the signs and symptoms is nothing but tetanic cramps and tingling sensation. So if the patient is hypocalcemic, that is around 8.5 to 10.5 is normal value. If it is less than 8.5, we will go for calcium supplementation. So when giving calcium supplementation, we have to also give vitamin D3, because calcium is enhanced by the presence of vitamin D, or vitamin D helps in the proper absorption of calcium from the intestines. Next is hypercalcemia, that is increased calcium level. So hyperparathyroidism, when the patient is immobile for long term, that is, for example, in case of long bone fractures, bone cancers, so excessive intake of calcium. So we'll come back to this immobility. So if the patient is on long bone fractures, there is the chance of the glucagon as well as the calcitonin as well as parathormone will be acting, and it will mishandles the calcium deposition from the bones. It will, which means the calcium will be taken from the bones, and it will take it will deposit it in the blood vessel. So it increases the blood calcium level, whereas the bone calcium level will be decreased, and it leads to osteoporosis. Okay, so flank pain, bone pain, constipation, and deep tendon reflexes will be decreased. So as a treatment, nothing you have to weight bearing exercises should be given. That is, immobility must be changed. Or if hypoparathyroidism is the condition, you have to treat that. Bone cancer is the condition, you have to treat. In other conditions, weight bearing exercise will be sufficient, so that calcitonin function will be regained, and it will take the excessive amount of calcium from the blood, and it will deposit in the blood teeth and the bones. Okay, so how will you calculate the fluid? So drop rate per minute. So it is taken as ml to be infused into drop factor by number of hours into 60 minutes. Okay, this is the drop rate. Please take this note, because you may get questions to calculate the drop rate per minute. Okay, so that was about the fluid and electrolyte balance. So we have completed the fluid and electrolyte balance. Okay. Okay, so we have completed the your 5-mark question. Okay, so next we'll go for the short questions of fluid and electrolyte balance. Okay.